What inspired you to create this transparent surgical model, and what parts of the traditional healthcare system, much like PBMs in the drug space, were you trying to get around?
Well, we started the Surgery Center of Oklahoma because, frankly, practicing in a big hospital as an anesthesiologist, I served as an accessory to a financial crime. Surgeons were also being denied the tools, many of them required to appropriately treat patients due to the cost-cutting measures at hospitals trying to maximize their revenues. And so as a hospital-based physician, the only way I could escape that was to own and control my own facility, and where I was responsible to the patients, not just for the medical treatment, but also the way financially we dealt with them. So if a patient asked, what can you do about this bill? My answer was everything, including not charge them. So we're in a good position to be charitable on an individual basis, and that's really the answer. We started it because we wanted to be in control of the medical and the financial journey the patient had in their healthcare experience.
Some patients, some people argue that patients won't shop for care or that it is too complicated to understand. Do you think that is true, and what savings have you seen for patients when prices are available?
Well, patients will not only shop for care, but they'll vote with their feet. Half the patients we see at Surgery Center of Oklahoma do not live in Oklahoma. We see patients from Europe and Africa, all over the United States. And self-funded employers see such an insane price difference between our prices and the local hospital where they're doing business. They waive all out of pocket for those employees and a companion to fly to Surgery Center of Oklahoma and have their procedure. And not just us, but those who've copied us. So people will shop and they'll travel. And furthermore, they'll hold our price up in front of their local hospital and tell them, match this or I'm going to Oklahoma City. We had a patient from Georgia that was going to be charged $40,000 for a urologic procedure, and our online price was $4,000, and the hospital matched our price because that would have been the second patient that month that came to Oklahoma City, and they didn't want to see that. The patient reached out to me later and said, you saved me $36,000 and you didn't even perform the surgery. So there is a market that is developing. It's a competitive market. It's driving prices down. It's driven prices down in Oklahoma City, I know, and quality goes up at the same time.